Hi, I'm Samantha Mango. Welcome to Sullivan 180 Presents Take 5. Our guest today is John Liddle, the new Commissioner of Health and Family Services for Sullivan County. John, welcome. Thanks for being here.
Thanks. It's good to see you again, Sam.
Can you please introduce yourself, your job title, and a brief introduction about your organization?
Sure. So I'm John Liddle. I uh, moved to Sullivan County back in 2019 to be the deputy county manager, and the opportunity came that I could be the social services commissioner. So here I am. Now I'm responsible for health and family services across Sullivan County government. So I'm responsible for not just social services, but also public health and community services, which is our mental health and substance abuse counseling branch. So lot to cover, but it's helping people every single day, which is what I've always wanted to do, and really happy with it.
You touched on a few of the departments, but can you talk a little more about the departments that you handle as a commissioner?
Yeah, sure. So I guess I'll kind of weave my way around the campus that we have in Liberty. So on one side, you have public health, and public health does everything you would expect public health to do. They've been huge during the pandemic and the mass vaccination clinics that we've run around the county. And it's not just COVID. Obviously, it's all sorts of infectious diseases that they have to focus on and be prepared for in epidemiology. Also, early intervention and work with young mothers and children to keep them healthy. And then, of course, there's Home Health Agency, or CHA, as you'll hear most people say. And the CHAs are, visiting nurses, basically, to get out around the county. Our team at the CHA has done a really phenomenal job, especially the last year and a half or so, to make it economically viable. They do great work, and we're really proud of them. So that's public health. I'm in social services. Primarily, I'm the state social services district commissioner, which is kind of my primary or my original title. And that's all that you would think with welfare, and also with children and adult services, not just protective services, but also preventive services and our foster care program. And then in community services, there is mental health. And like I said, there's mental health clinic. And then there's also, in the state agency's way of viewing it, there's the Office of Mental Health, and there's OASIS, so substance abuse services. And so we provide cognitive therapy, and then also medication-assisted therapy, telehealth services. And then can't really forget, but we do still have the county-owned nursing home, which, there have been changes to that, but those are still employees of our division. They're county employees. We take care of them and make sure that they're looked after as we work through the transition with the company, the management company that's going to be helping us out there.
Can you talk a little bit about your new plan for the 4 E's?
Yeah, the 4 E's is kind of welcome to the new job, and here's this massive project that we need you to take on. It's really all about improving Sullivan County's county health rankings. The county health rankings come from the Robert Wood Johnson Foundation. You can go to rwjf.org or countyhealthrankings.org to kind of get the details. But Sullivan County, we've been working for a long time on this issue to try and improve our health rankings. We've been kind of stuck in recent years, and really, I think what we're trying to do to get ourselves unstuck, which is where the 4 E's come from, is to really look at the issues of the county health rankings more holistically. Because one of the things that they harp on at RWJF is that it's really community factors, socioeconomic factors, social determinants of health that really impact how the health of a community works. So it's not just about cardiovascular disease and reducing smoking and healthy diet and exercise. Those are all important things, obviously, but really making sure that folks have good paying jobs and the stress that comes off a person when they have a stable job and a stable home and things like that. So we're looking at affordable housing, we're looking at education, we're looking at all those sorts of things. And that's one of the E's. That's enhancing our community, doing things we need to do to enhance the community and make it a better, easier place to live. So we got to help lift folks up out of poverty. That's one biggie, enhancing our community. Probably the most important, actually, of all the four, at least right now, is ending the opioid crisis. It's a problem that's only gotten worse over the course of the pandemic, and you can imagine why. Folks are stressed, folks are isolated, folks are, lost their jobs. This contributes to a feeling of hopelessness, and folks, turn to medication. They turn to, illicit substances, unfortunately, in some cases. And so we have to do what we can to help those folks and their families, because nobody goes through it themselves. And so working through those problems and helping Sullivan County fully recover and end this opioid crisis once and for all will probably do more for improving our health rankings than anything, actually. And I'm really encouraged by all the work that my deputy commissioner, Wendy Brown, has been working on this for a long time. She's building up great partnerships, law enforcement, public health communities, working together with our policymakers, and all the things are starting to click. And then the third E is easing access to care. One of the statistics I recently reviewed was that we have 2,900 people for every one primary care provider, which is almost double the average around the state and around the country. Kind of two pieces to easing access to care. The third E is getting more providers into the county where we can, working with our partners at Garnet, at Crystal Run, and finding ways to incentivize people to come to the county. And then there's also making people aware of what already is available to them. We are a rural area, but we also have a lot of connections to the city. We have a strong sense of community. We have organizations like 180 that are doing so much for us. And there are plenty of folks out there that can help folks get connected to care. And we need to keep bridging those gaps and keep connecting people more and more. And then the last thing is something that our public health team and 180 have been working on to encourage healthy behaviors. That's the fourth E. And that's really, kind of what has been talked about around here for a long time, working on the county health assessment, the county health improvement plan, to really improve healthy behaviors, make it easier for folks to find healthy food, make it educate kids on how they can have a healthier lifestyle.
Is there anything else that you'd like to add?
I guess the last thing I would say is that this is something that has really garnered the attention of the Sullivan County Legislature. They're ready to take action and make some real changes because they know that, not for lack of hard work, but we just haven't been able to really make a dent in these rankings yet. And they are interested in how they can invest in the problems and make some real changes come to Sullivan County. So we're pretty excited about that, and my team is going to work hard with all of our different stakeholders to make sure that this money that is coming in from federal stimulus and such, that we invest it smartly and really make some positive progress for our community's health.
Thanks for joining us today, John. We're looking forward to continuing our partnership with you to make Sullivan County a healthier place to live.
Good to talk to you, Sam.